In this video, I'm going to talk a little bit about the safety of exercise for patients who have conditions such as osteopenia and osteoporosis, because it is very understandable that patients would be concerned that if they exercise that they're just going to make things worse or sustain an injury or at worst have a fracture. So I'm going to just explain what the do's and don'ts are. Briefly, like I said in an earlier video, the patients who fall into the low risk category, so they don't necessarily have any particular diagnosis of osteopenia, but are interested in just exercising to improve bone health. Obviously there's no safety risks there. For medium risk patients, so that's people who have a diagnosis of osteopenia, again, as long as you haven't had a fracture, there's really no risk involved and you're safe to go ahead with any of the exercises. And just on that note, our body will tell us if something isn't right. So if you did a lot of exercise and had a lot of pain, that will be an indication that maybe not necessarily that you need to stop exercise, but you need to check things out with your physiotherapist before you continue. But then we have a higher risk category of patients. So this will include patients who have an established diagnosis of osteoporosis, or they have osteopenia with documented bone fractures. And again, that applies to osteoporosis with documented bone fractures. Here, you do need to be a little bit more cautious about the exercise you're doing. Again, it's largely safe, but there are a few things that you shouldn't do. So for example, patients who have osteoporosis and have had a bone fracture, and again, osteopenia with a bone fracture applies here too, they shouldn't really do exercise that involves a lot of forward flexion. So that would be things like reaching down and touching your toes or trying to stretch your back down. So involving like a lot of flexion like this, or things that involve a lot of rotation or twisting of your body. Those things wouldn't be advisable. And that's because when you flex the abdominal muscles, flex them forward, that can increase pressure within the discs in your back. And if you have fragile vertebral bodies, then you could theoretically increase your risk of fracture. Now, I will also say at this point that the studies have shown even in these patients, the risk of fracture is low, but I just think an element of caution needs to be applied. You would definitely need to be supervised in the first stages of exercise and do it gradually. Other than that, exercise appears to be safe and it appears to overall improve bone health. When we do the back extension exercises, it's important to note that these actually have been researched and are deemed to be safe in patients who have osteoporosis.